Everyone knows drugs are used for beneficial therapeutic effects, but do you know sometimes drugs show some undesirable toxic effects? These are called adverse drug reactions.
Okay, dear student, today I am going to discuss with a new topic called ADR or adverse drug reaction, ADR. So now, when a patient or when a simple pupil is taking any drug, so that drug will show any action. We are taking the drug because we have some disease or some disorder or some abnormalities for which we are taking the drug. So when we are taking the drug is going to a specific site and showing their action against all this disease and used to treat it. So that is called as therapeutic effect. But everything in that world have a positive thing, same that all we have negative things also, like mobile or internet, they have some positive way to use and they have some negative effect on our daily life also. So like that, drug also have positive and negative side. What is positive side? Positive side for which we are taking the drug, when that drug is treating that abnormality, disease or disorder, that is called as therapeutic effect or that is positive response. And when except all that therapeutic effect, some unwanted effect also is showing by different drugs that are undesirable, secondary and toxic in nature. That is considered as the negative effect or negative response of drugs. So like everything, drug also have some positive and negative part. Most of the drug have positive part that we are telling as therapeutic effect or desired effect. Therapeutic effect or desired effect. And negative effect is called as adverse drug reaction. There are secondary reactions, non-wanted or unwanted, undesirable, toxic in nature. All that secondary and unwanted reaction or effects of drug is called as adverse drug reaction. So in that next slide or in that video, we are going to discuss about all the toxic and unwanted effect that is going to show by specific drug in our body. So first, by the name or by that easy description only, you can understand ADR means adverse drug reaction, that is unwanted undesirable effect that are showing by a drug that are secondary, toxic for our body. Those unwanted effects are called as adverse drug reaction and it have different reasons why all that adverse reaction are showed by the drug. That reasons we are telling one by one. Now you have to understand what are the possible reasons for adverse drug reaction. So what are the reasons for adverse drug reaction? The first and foremost reason that can be excess use of any drug. Just suppose you are taking a drug in high amount for a prolonged period of time. That time that drug with therapeutic effect also, they are started to showing different unwanted adverse drug reaction. The second reason it may be due to the use of expired drug. You know every drug has a expired date. When the drug is spending their lifetime and they exceed their expiry date, that time drugs become less potent, they started to show less therapeutic effect and that time they are going to show different non-desirable, unwanted, toxic effect or adverse effect. So use of expired drug also is a reason of for adverse drug reaction. Third thing for that, it can be allergic reaction. You know, some people have allergy with different things. Like some people are allergic to milk. So who are allergic to milk, when they are going to take milk or milk product or milk based any drug, this will cause different unwanted and non-toxic secondary effect into their body. That is also a reason for adverse drug reaction. Some other top reason can be idiosyncrasy. Then also can be used for withdrawal of drug. What is withdrawal of drug? Withdrawal of drug is when you are taking a drug for a prolonged period of time, then suddenly after using for a long time, you stop the usage of the drug. Due to the sudden stoppage of the drug, it can cause different unwanted effect in our body that we are not expecting at all, and they are not predictable at all. All that also a reason for the adverse drug reaction. So these all are the possible reason why a drug started to show adverse drug reaction in a human body due to different reasons that I have discussed now. The next thing you have to study about adverse drug reaction is different types of adverse drug reaction. So different adverse drug reaction is shown by the drugs. They are unwanted, undesirable and toxic in nature and secondary responses, I told you. So according to their type and how the drug is going to show and by which reason the drug is showing the action or adverse drug reaction and which type of reaction it is, based on that different adverse reactions are classified into 6 types, that are A, B, C, D, E, F. That all types have a full name that are denoted by short name like A, B, C, D, E, F. That all are the types of adverse drug reaction that we are going to discuss into one by one into the upcoming slides. So the first type of adverse drug reaction, that is A, and that all are called as augmented adverse drug reaction. Augmented means excess use of drug. So what is the augmented or A type of adverse drug reaction? That are the unwanted reactions of our body or reaction effect of a drug when the drug is going to take for high doses in high frequency. So by the time that drug is going to accumulate in our body, and due to their accumulation they showed their different adverse drug reactions. Those are called as augmented or A type adverse drug reaction. These reactions are dose dependent, predictable, and they all are reversible, means they can be treated by taking another drug. So these are called as augmented adverse drug reaction. Like example is high use of insulin. We know insulin, when we are using insulin, we use when our body are going to produce more sugar, or sugar level when it is increased in our body, we generally take insulin. But taking of insulin in high dose for a extended period of time can cause hypoglycemia. That is a also disorder condition, abnormal condition in our body, in which the amount of sugar or glucose in the blood started to decrease than the normal level also. So these are augmented adverse drug reaction. An example is hypoglycemia due to over or excess use of insulin. The second type is B, or these are called bizarre drug of reaction or adverse drug reaction. These are reactions which are shown by the drug that are toxic in nature. All adverse drugs are toxic in nature, but for all that effect, the reason of all this adverse drug reaction is unknown. So the specific reason for all this adverse reaction or reason for that adverse drug reactions are unknown in nature. So all that adverse drug reactions are unpredictable, dose independent, and may be reversible or may be irreversible depend upon the reason, but most of the bizarre adverse drug reactions are irreversible because we don't know the perfect or specific reason why that reaction is going to show in our body. So they are irreversible or untreatable most of the time. Example is hypersensitivity reaction. These bizarre reactions of our body or bizarre adverse drug reaction, it may be shown. Some reason can be due to allergy or idiosyncrasy. So this can be a reason for bizarre adverse drug reaction, but most of the time the reason is unknown. C type of adverse drug reaction. What is the meaning of C? The full name of C is continuous adverse drug reaction. From the name only you can understand continuous means for a prolonged period of time. So these all are the adverse reaction that is shown by a drug due to high use of drug or overuse of a drug for a prolonged period of time. So when we are taking a drug for a high period of time to a high dose for a prolonged time, this also can cause some undesirable reaction that are called as C or continuous type of adverse drug reaction. The example is high use or high time use of that high type use of antidepressant can cause sedative effect or addictive effect. So that are called as continuous effect for due to the extended period of use of a specific drug, it causes different adverse drug reaction that is called as continuous adverse drug reaction or C-type drug of reaction. The next type of adverse drug reaction is D type of reaction or D type of adverse drug reaction. What is the mean of that? Is mean of delayed. That you can easily understand by the name, that a drug is taken into our body after a long time of delay. Means you have a specific action in your body or disease, for that you have to take drug, but you are taking the drug after a long time. Then you are using the drug at a high range or high dose for a long prolonged time. So due to that use of prolonged and delay time, that drug is started to show different adverse drug reaction which are unwanted for our body. So these are also the reactions which are caused by the drug for a prolonged use or prolonged time use of a drug. Example is alpha adrenergic drugs, which are generally used also to treat BP when they are taking into the pregnant women, that can cause the death of the fetus in our body. So generally all the drugs are prohibited or inhibited of use when a woman in pregnancy. So in case of pregnancy women, all that drugs are prohibited to use, but by chance if any drug we should not use for the pregnant woman, if by mistakenly that pregnant woman started to take that drug, it caused a different delayed or D type of reaction that is called as teratogenic effect. So by that name only you can understand now that teratogenic effect is when a drug is going to take a for a pregnant woman, that a specific drug that can cause the death of the fetus into the pregnant woman. All that drugs are teratogenic in nature and their adverse effect is called as teratogenic effect. So there's all that drug which are having teratogenic effect that can't be used into the pregnant woman because it can cause the death of fetus. So all that drug during the pregnancy time is prohibited for use. Then E. The next type of adverse drug reaction is E, or called as end of use. What is the cause of that adverse drug reaction and what are the type of adverse drug reaction? That E type of adverse drug reaction is due to the sudden stoppage of a sudden stop of using a drug of using a drug. So let's suppose you are taking a drug, that is drug A, for 4 months or 2 months to decrease or to overcome a disease. But after 4 months you suddenly stop using that drug. So due to that sudden use of drug can cause the reoccurrence of that same disease for which you started to take the drug for a prolonged period of time. For all that drugs, this type of adverse drug reaction can be seen that are called end of use or E type of adverse drug reaction. Example, you can understand very easily by that example how E type of adverse reaction generally showed by our body. That is, just suppose you have hypertension or high BP. So to treat that thing, you are taking a antihypertensive, that is clonidine, and you are using that clonidine for a prolonged period of time to decrease your high pressure or blood pressure. So when you are using that drug for a prolonged period of time and after a certain time when you are starting to stop that drug, this can cause the reoccurrence of hyper pressure, or that is called high blood pressure. So this is type of called is E type of. So for that, what is happen when we are taking a drug for a prolonged period of time like clonidine, what we are using for antihypertensive, when we are using for a prolonged period of time, and then after prolonged use when we are stopping that drug suddenly, that can cause the reoccurrence of the drug disease. That for that we are taking that drug generally. Here clonidine we are taking to treat high BP, but when you are after using, you stop that usage of the drug, it causes the reoccurrence of the hypertension, that is high blood pressure, that are called as E type of adverse drug reactions. The last type of adverse drug reaction is F, that is failure of efficacy. When I discuss about different reason of adverse drug reaction, one reason I told you that expired drug. So every drug has a manufacturing date and expiry date. So why that is written manufacturing date and expiry date, in between that the drug has maximum potency or efficacy when that drug is showing more or specific action and less adverse drug reaction. But after that expiry of that drug is started to deteriorate and their potency and efficacy is started to reduce. When their potency and efficacy is started to reduce, they started to show negative action and their positive action started to showing decreasement. So when their potency and efficacy is decreasing after expiry date, that drug started to show less therapeutic effect and their efficacy started to downfall, and they started to show undesirable effect, or they failed to show their desirable therapeutic effect or efficacy. Due to that lack of efficacy, they showed negative undesirable toxic reaction that can lead to adverse drug reaction. So that type of adverse drug reaction is called as failure or F type of adverse drug reaction. It can be caused by different reasons, like drug interaction is one of the reasons by which it is can cause, or one more reason it can be use of expired drug, because after using of expired drug, that potency and efficacy started to fall down and they are showing to show different unwanted adverse effect. So these are F type of adverse drug reaction. So by that I have described you what is adverse drug reaction, what is the possible reasons for the adverse reaction, what are the types of adverse reaction, in which we studied about 6 type of adverse drug reaction, that is A, B, C, D, E, F, where A means augmented, B means bizarre, C means continuous, D means the delayed, E means end of life, and F means failure of efficacy. All that are 6 type of adverse drug reaction that can be showed by our drug due to different reason that we have also discussed into that video. So in that next video we are going to the main topic of different drugs which are going to acting on autonomic nervous system. In that we are going to study sympathomimetic, sympatholytic, parasympathomimetic, parasympatholytic into the upcoming classes. For now it's done and dusted, and go and check that adverse drug reaction. If you have any problem, you can ask me in the comment box, and the written notes for that adverse drug reactions are also I made, that will be given into our description as a link. You can go through that drive link and you can check the notes. So thank you. Study well adverse drug reaction.